Hi. So we are talking today about hypercalcemia, in which the calcium level is pretty much higher than normal. So there is a specific guidelines. We're talking here about hospital settings. So you are in the secondary care, you are inside the hospital, and you receive the call that one of your patient who is under diagnosis for waiting whatever scans, and they did bone profile, and his calcium come back 3, or you had a referral from a GP that a patient come over and his calcium was 3. What to do? What to do? All right, because it's one of the most important case and situations in the hospital, because you need to treat it on urgent basis to avoid dysrhythmia. Again, we are talking about acute settings in the hospital, so you will need to know how to treat it. Okay, so there is a guidelines, you will find it attached in the drive, but to know exactly what to do, make sure that you know the levels of the normal calcium, and make sure that your eye at a glance pick number 3. If the calcium is more than 3, it does mean that the patient has severe, a moderate to severe hypercalcemia, and they need urgent treatment. Uh, Before the treatment, you will request an ECG to look for shortened QT interval. All right, good. So, how to manage a case with hypercalcemia in acute setting? How to take the calcium down? I'm not talking about the investigation to find out the cause. I'm talking about how to treat it now. You will give 4 liters of fluid as a start over 24 hours. 4 liters, yes, 4 liters. You will prescribe 4 liters of sodium chloride over 24 hours, and after 24 hours you will repeat again the bone profile to look at the calcium and see if it is still high, or it's below that. If it is still high after 24 hours, you will need, and high again, I mean more than 3, you will need to give IV bamidronate 30 milligram, or you will give zoledronic acid 4 milligram over 15 minutes. Okay, most of the hospitals now give zoledronic acid 4 milligram over 15 minutes. Okay, thank you for that. How to prescribe? How to prescribe? Okay, so if you had the flow chart in front of you, okay, don't to prescribe 1 liter by 1 liter. Always prescribe all in one sitting. If you are giving 4 liters as a start, or 6 liters, but 4 liters we stuck to, you will give sodium chloride 0.9%, 1 liter over 6 hours, and you will do the prescription and put your name and put your belief number, right? And just document clearly that after 24 hour and hand it over. After 24 hour, you will need a repeat blood test for calcium level, and to make sure if it is more than 3, you will give zoledronic acid 4 milligram over 15 minutes. All right, good. This is about hypercalcemia. For the intelligence doctors, they will tell me, okay, what 4 liters is too much, 6 liters is really too much. What should I do? You should put a flow chart. So on your documentation, when you document it as well, make sure that you are putting a flow chart, and tell the nurse that this patient needs a fluid chart in place. The input and the output, right? Because you are giving lots of fluid to this patient. Special occasion when the patient is overloaded, and you know that the patient has a heart failure, his GVB is to the roof, and he had ascites, or he had uh, some crackle, or some inspiratory crepitation on the back of his chest. He had a chest X-ray, and you know that the patient is overloaded. What to do? Shall I give fluid to this patient? No. What to do? Zoledronic acid directly. Zoledronic acid directly, or bamidronate, according to your trust policy. All right. So input and output is one of the important things to do. Other doctors would like to know, okay, I did treat it, and because the patient came from outside, I have no idea what is the next step to do. Shall I do some blood test on top of the BIM profile? Yes, if you would like to do, it will be, everyone will thank you for that. But to know what to do, you will need to rule out a lot of stuff. The most common thing is for hypercalcemia is in elderly patient is multiple myeloma and that primary hyperparathyroidism. So you will request a BTH, and you will try to, and you will request the electrolyte immuno, and you will request the immunoglobulin as well. And you will need to do chest X-ray for this patient, CT tap, to rule out primary cancers. All right. And there is, for the primary care, we will discuss it in another video. There is a very specific pathway for the hypercalcemia, depending on the PTH. Usually, you will go for the vitamin D, and chest X-ray will examine the breast and request BCA myeloma screen, and chest X-ray and the CT tab, to make sure you are not missing anything. You will find all what we talked about today in the drive. Please do a good reading. It is one of the most common problems in the acute setting in the hospital, and you should know what to do, and do not hesitate to prescribe the fluids, and to document clearly what is the next step, and put the input and output chart in place. And thank you very much.